Hello, I'm Cindy with Wisconsin Voices for Recovery, and this is Speak Out on Stigma. Today we'll be hearing from Dr. Siobhan Wilson, a faculty member at the UW School of Medicine and primary care provider in internal medicine. Hey, Siobhan, how are you today?
I'm great, and I'm really excited to speak on this topic. It's really an important part of the teaching I do and really important to how I deliver clinical care.
Awesome. Welcome. So, if you could tell me, what do you think makes people use stigmatizing language?
That's a great question. I think it's often unintentional. It's words we've heard, it's words we've learned, it's vocabulary that we have already got stuck in our heads. And especially if we're not in a particular group, it might not occur to us with all of our implicit biases, the biases we don't even know we carry with us. It might not be obvious to us how those words might land for other people. So I think a lot of stigmatizing language is because we don't know we're doing it or how much it hurts. There are, I'd say, fewer people who use stigmatizing language on purpose to demean or to hurt other people. Um, I think a lot of the stigmatizing language in medicine where I work is unintentional, and with enough of the right kinds of pushes, we can do a lot better.
And how can reducing stigma help save lives?
Um, I can't help somebody if I can't get them in my clinic. I can't get somebody in my clinic as a primary care provider unless they feel safe there. And feeling safe in my clinic means that when they come to see me or any of my staff members, the person who checks them in, the medical assistant who takes their vital signs, the nurses that they talk to on the phone, at every level, if this person does not feel safe talking to people or being honest and open about their concerns, then it's chipping away at the likelihood that they're going to be able to come to clinic. Um, in the clinic, people bring internalized bias, cultural bias. I can't even count the number of times people will say, well, I'm just fat or I'm not working hard enough. And that's such a closed mindset that it hurts and is painful. And it also really prevents us from creating a growth mindset, creating the possibility of change in our own minds from a provider standpoint, from a patient standpoint. So I like to push back at the language in all kinds of domains, um, because if I can help my patients feel seen, heard, validated, respected, they'll be much more likely to come see me and to be able to talk about the topics that are in the way of their health and happiness. Um, it's such a privilege to work with people on their health related goals. And I think the best feedback I can ever get is when one of my patients says, I feel safe and heard here. That's the beginning of where we make progress and how we start to save lives.
Yeah, absolutely. And I like how you mentioned the growth mindset. For those that might be interested in incorporating that into their practice, their clinic, what would that look like?
I think it's, um, I have unearned power as the doctor in the room. I have the prescription pad, I have the order entry abilities. Um, and one of the things that I can do to be really helpful with that power is to call out those moments where somebody is experiencing bias outside of the system or in their own minds and hearts. Um, so I can interrupt that. So I can say, hey, this sounds really like it feels like it's all your fault. There's a lot happening here. And if we can think about what's getting in the way of progress or of healing, then that's how we can start to make progress. So by identifying it, by pointing at it, I really can help people solve, be an active participant in helping us move along. I think the core of what I do in clinic is built on motivational interviewing, which is really helping people identify their own strengths and find their own paths and the strongest way I can do that is by using reflections of moments of power and progress that people have already achieved, and really helping build up their understanding of what they already contain inside of them so that they can feel empowered to make that next step. That's one really great opportunity. And then in the clinic room, I'm also somebody who can, I think, take down the power of um, language or negative things that have happened. I can call it out and say, you say you can't, but look, you did. Or I can identify wording that was heard in a different clinical context or outside of clinic as toxic and negative. Or I can just say, the way you talk about that sounds like you don't think that there's any ability to change. Is that true? Just by reflecting, I think the positives that people already hold inside of them and their ability to grow and change, and to fight back against stigma, I can help facilitate that. So those are, I'd say, 2 or 3 moments in clinic where I see an opportunity.
Thank you for elaborating. Is there anything else you'd like to add?
I'm just really glad that, especially in this really tough time, that this project is going on. I hope that this project can make people feel safer in the world and safer accessing the medical system, because everybody deserves excellent care and respect.
Thank you so much, Dr. Wilson, for sharing your views on stigma. And thank you to our viewers for watching. Speak Out on Stigma is a forum to raise awareness about the harmful impact of stigma on those in and seeking recovery. Recovery is for everyone. Together, we can eliminate stigma. Don't forget to like, comment, and share this video. Thank you and have a great day.